with Dr. Steve North, who is a practicing physician here in Bakersville at the clinic, and he also is in charge of the health program of two of the schools here in Mitchell County. Dr. North, thank you very much for being here today and for agreeing to some comments.
Absolutely, thank you.
And from what I hear, you've been the spirit and the driving force behind this telemedicine project from the beginning, very much?
Yeah, I think that this is my idea, so if it is successful, great, and if it fails, I'm going to be run out of town.
And, briefly, could you describe what the system will be like when you get it done?
Sure, we're going to be using video conferencing systems made by a company called Canberra, and pairing those with peripheral devices so that we can look at ear, nose, throat, listen to heart and lungs, look at rashes and bruises, and really do a full exam in the setting of the school. The goal really is to help kids stay at school and help address health issues that prevent kids from being as prepared to learn as possible. One of the things parents often find is it's real hard to get in to see a physician in the afternoon when you get that call from school and says Johnny's got a fever. We're trying to sort of make it easier for kids to be seen at school in combination with parental approval. We're a long way from Asheville. For most folks, it's at least an hour drive. A longer way from Charlotte, 2.5, 3 hours to get down to see specialists there. And UNC, Wake Forest, and Duke are again miles away, and a day's trip at least. The hub site's at the center, and the spokes go out. And the hub is where Eloise will be, and she'll be able to see kids from 3 different schools initially. And what we'll provide are on-demand acute care services and partnering with local physicians to monitor kids' health, see how their asthma's doing, watch their blood pressure. And now I'd like to connect this up with Harris Middle School in Spruce Pine. Hey Mark, how you doing? Great. Eardrum. There is some scarring. If you look to the left of the screen, you can see some scarring from old ear infections. That is the drum right there front and center. And pretty easy to diagnose strep throat in a kid when you can see it this big on a screen. We're the first school-based telemedicine network in the state of North Carolina. Additionally, nationally, we're the first community-based program.
And today you're celebrating sort of the launching of this system.
Yeah.
And we've been able to see demonstration of the internet connectivity and how the system will work some. This project started when? Back in 2007, maybe?
Back in 2007 is when I began to get some help in the project through the North Carolina Foundation for Advanced Health Program.
Yeah, Yancey Foundation reviewed an application in 2008, and we were very impressed with the system and provided some funding, $7,000 for a needs study.
Yep.
How did that needs study help you along the path to getting to where you are today?
The needs assessment that we've done really has provided us with the leverage to secure more grant funding. Without that needs assessment, we'd just be saying, hey, this is a great idea. It makes us feel good. We think it'll work. However, with real data, taking it to funders and saying, we have broad-based community support, we've really been able to convince people much more easily.
And the initial launch is going to be in 3 schools, 2 in Mitchell County and 1 in Yancey County, I believe.
Right, 2 in Mitchell County, Harris and Bowman. Yancey County has school-based health centers at East Yancey and Cane River, and so sort of an ability to compare what we're doing in one place with what occurs at another. And then Micaville is a vibrant elementary school with a great school nurse. Right now we have funding to be in 11 schools, equally matched between Mitchell and Yancey counties. And then we have funds pending to go into another 5 schools in both counties.
Thank you very much.
Thank you.
Appreciate today.
Really appreciate your time.